Endurance riding is a challenging sport, not only to the horse and rider, but also to the veterinarian who acts in a controlled capacity during the competition. The purpose of this video is to introduce you to the sport of endurance riding and expose you to some of the challenges that you'll face as a control veterinarian. Yeah, this is a competition, 100-mile endurance competition today. It's the first vet check. We had the first horses, 4 or 5 horses come off the trail, 19-mile loop, and it's 8:20. They started at 6:30 this morning. That's real typical early morning start for this type of athletic event. Endurance riding has been around for over 30 years. AERC was organized back in 1972, and it started in the West, but it's a really rapidly growing equine sport. It's one of the most rapid growing equine sports today in America. These horses have just come off about a 19-mile loop. You can see most of the horses have a blanket on their rumps there to keep warm, and they're eating and being offered hay. The competitions typically in endurance are 50-mile to 100-mile competitions held over a certain maximum time period, or a certain time period is given for completion. Typically, rides are held in a one-day period, but there are multi-day rides throughout the country. Usually the multi-day rides are in 50-mile increments that are completed in separate days. The horses are regulated by veterinary examination at multiple time points during the ride, which is determined by the veterinary control staff. And in this ride we have multiple vet checks. This is the first vet check here we're at this morning. It's about 40 degrees, so a lot of these horses have blankets on, keep them warm. We tend to see problems with muscle as far as tying up, and rhabdomyolysis is not uncommon with horses in this sport. Usually we do see those problems early on, and it's not unusual to see them at the first vet check or on trail in the first 20 miles.
This is a typical AERC vet card. Let's take a look at its use in a vet check. The arrival time is the time that the horse actually comes to the timer off the trail. His time will continue to run until his rider presents him to the pulse taker. PR time. The horse has only 30 minutes after arrival to meet pulse criteria, which is normally somewhere between 60 and 64 beats per minute. When the rider is confident that the horse has reached criteria, he presents him to the pulse taker, who confirms that the horse has reached criteria and enters the current time as the PR time on the vet card. Pulse. Also record the horse's actual pulse on the appropriate line on the vet card. Out time. Normally the horse has a preset mandatory hold or rest time that ranges anywhere from 15 to 60 minutes every 12 to 20 miles. The time for the hold is added to the PR time and then entered as the horse's out time. The next 5 categories on the vet card: mucous membrane, capillary refill, jugular refill, gut sounds, and skin tinting are all hydration factors.
You on there? Yeah. Hey Mike, how are you?
Good.
Hey buddy, what's his name again?
Louis.
So we're just assessing the horse's mucous membrane color, capillary refill, moistness. You can see he's got a fairly quick refill, less than 2 seconds. The color's fairly good. Nice and moist. So he's well hydrated there. Y'all had a long trip?
Yep, about 2,000 miles.
Yeah.
From Illinois.
Must have been drinking well though. Jugular refill is normal. You can see it fill with distension there, and then his skin tint, which is also a hydration factor, done at the point of the shoulder, is also normal. If you move up to the neck, it's not really a good consistent place to do a skin tint because it's more variable in horses, especially as they age. You can see his skin tint there is a little slower than it is at the point of the shoulder, so it's most consistent right here. So he's well hydrated. So now we're going to check the horse's gut sounds. At the same time that I'm listening, I'm going to be evaluating for the presence of thumps or synchronous diaphragmatic flutter, which is really common with endurance horses. So as you listen in both the upper and lower quadrants on both sides, because thumps can be present on one side and not the other, as the diaphragm jumps or contracts with each atrial contraction. You can feel for it as well as assess your gut sounds at the same time. Check all 4 quadrants and listen for the normal slow rumbling sound. And then especially want to evaluate on both sides for gut sounds as well as the presence of thumps. Occasionally it'll be more pronounced or even only present on one side. And with real subtle cases, sometimes you have to sculpt the heart at the same time that you feel the horse's flank. And when there is synchronous diaphragmatic flutter, the diaphragm will be contracting at the same time you hear a heartbeat. So his gut sounds are quite good. He's been drinking and eating well then?
Yeah, yes.
Okay.
Moving down the vet card, the next categories deal with anal tone, muscle tone, back soreness, tack galls, and wounds.
Going to move on down then, being fairly efficient. On the first check-in, you can take a little more time, but as the ride goes on, you certainly want to be efficient and but yet complete. His back pain that I checked there, just by running my hands down and applying firm pressure to the epaxial musculature as you come down without using pointed fingers like that, that would be not something you'd want to judge a back pain on, but just firm pressure, smooth down the back is normal. So that back would be an A as well. Okay, and then as you evaluate the horse for signs of tack galls and wounds, you want to palpate the girth area, up in the axillary area on both sides. Apply just even pressure. And after you evaluate the girth, then other places to evaluate for tack wounds, you need to look at the horse's mouth, the edge of his lips for any abrasions or bleeding at the edge of the lip where the bit rides. Sometimes in the mouth you may see a little bleeding. So again, evaluate it on both sides, especially later in the ride. Okay, so when we're evaluating muscle tone, just want to apply even pressure, note the suppleness in that gluteal musculature there, and move down, assess the thigh region. It's not uncommon for horses to get muscle cramps up in pretty deep in the thigh, so don't forget to palpate deep in that region. Move around to the other side. Again, assess the gluteals and the deep thigh. Okay, and when horses tie up, it's not uncommon for certain of the muscle groups to be affected more or less than the others, so you want to make sure you evaluate the cranial gluteal belly as well as the others individually. Sometimes horses will actually tie up in the lumbar region as well, and muscles down here, so you need to do a good palpation throughout the area and evaluate suppleness. And even check for anal tone, which is with certain points of exhaustion you'll get a really relaxed anal tone, and you want to evaluate that as well. Evaluate the horse fairly efficiently, come around to both sides. If you need to check his back again, you can, but you ought to be able to get things in one clean sweep. No interference marks really. He's got an old wound here on the left hind that you'd want to mark on the rider card.
The vet trots out the horse to look for signs of lameness and to evaluate the horse's impulsion and general attitude. At this time during an exam in an actual endurance ride, a cardiac recovery index or a CRI may also be taken.
I'll take a first heart rate, and then after I do that, we'll trot him down to that corner. See where that little flag is at the corner?
Yeah, I see it.
So that'll be about 125 feet. We'll trot him down there, and exactly a minute later I'll recheck his heart rate again, and that gives us an indication of fitness and ability to recover for the conditions. And again, just like as you were listening to gut sounds, you can, as you're taking the heart rate, to be more efficient, you can coordinate your exam so that you're continuing to examine the horse as you're taking the heart rate for 15 seconds. So the cardiac recovery index, or a CRI, is something we'll often use sometimes at every vet check. Okay, if you can trot him down to that corner and back then, just on a loose lead line, let him have his head and trot him all the way down and back. So as we watch him move, we're judging his impulsion, willingness to move forward, and also evaluating him for any sign of lameness, either a head bob or a hip hike. Horses all move a little bit different, so you have to watch them and kind of evaluate them individually as they move. Certainly an attitude of an A.
Okay.
Take his heart rate at exactly a minute. The heart rate on initial check should be the same as on the second one. Usually during a ride, especially as time goes on, depending on the conditions, heat and humidity, we'd still like to see it the same number the second time, or maybe 4 beats at the most elevated. And we use that again to judge their recovery in light of all the other signs of hydration and their attitude, you know, to see if they're fit to continue. So.
At this point, based on the total exam, the vet grades an overall impression of the horse.
Okay, I'm just going to go ahead and check his rectal temperature. I don't think we're going to have real hot conditions here, but a lot of times we'll have the pulse. The P&R people take this before, but for this instructive purposes, I'm going to take his temperature. Sometimes during the ride, certainly if a horse is not recovering well, you know, you've probably seen us take temperatures before. Horses that might be sweating profusely or not sweating enough or panting that look like they may be having a hard time with thermoregulation or overheating, we certainly take their temperature. Cindy, you may have scribed before, but we get a lot of new scribes, so I wanted to walk you through this card and explain the different parameters that we record and the different letters that we use to indicate the severity of a problem or the normality of a problem. If it's an A, it's certainly normal, and then if it's a D, it's very abnormal. But to start on a pre-ride, we'll always, if there are any existing wounds, say an interference mark here on the left front fetlock, we'll want to circle that, or if there's some girth rub or a back issue that's an existing wound, we'd put that down on the pre-check so that it'd be noted on any checks later. And we'd also, the original pulse at the pre-ride, whether it was taken by the PR person or myself or a veterinarian, you'd write there under the pulse. Frequently we'll take the temperature, the P&R people will take that and record it there for the pre-check. As far as different parameters, it's really common for veterinarians, once we get very efficient at it, we'll yell out the first 4, which are all parameters used to evaluate hydration. And so I might be on the other side of the horse or a little bit away from you and say, okay, the first 4 A's or whatever, if they're normal. So mucous membrane is the first parameter that we look at, and we'll be assessing mucous membrane color, make sure it's a normal pink color, and also that it's the horse has normal moistness to their mucous membranes. As well, the color can change during the ride. They can get hyperemic or injected at the gum line. It can even get purple if they get in trouble. So that would be where we put the mucous membrane evaluation. And then cap refill is just the time that it takes for the blood to fill back in on the gums once you press your thumb there and then pull it away. So it blanches white and then it refills pink. And so we'd note that there. If it was less than 2 seconds, it'd be an A. So jugular refill is the same thing. You know, at the base of the horse's neck, you hold off his jugular vein, assess how quickly it refills. It should fill pretty quick, you know, within a second or two. So, and again, put that there, A, B, whatever. Gut sounds we evaluate back at the flank, whether they're normal in all four quadrants, a little bit reduced in 1 or 2 quadrants, or totally absent, then we'd give it a grade from A at normal and down to C if there are very few sounds or absent sounds. And then skin tinning is the next parameter, so we'll pinch the skin at the horse's shoulder, not on his neck, but at the shoulder, and evaluate how rapidly it springs back, and it should spring right back, and that would be an A. If it's delayed, then depending on how delayed it was, it would be graded from there. Muscle tone, we'll evaluate at the hips, at the gluteal region, as well as the thigh region for muscle tone, how supple the muscle is. And then